So let's move on to January 2023 recalls. Question number 68. 11-day baby with bile stain, vomiting, abdominal distension, blood in the stool. Baby is only 11 day, distension of abdomen, started vomitings and bile stain. Blood in the stool means you can think of duodenal atresia, but it is 11 days. They are survived. Necrotizing enterocolitis is more common. Overweight 12-year-old hip pain, antalgic gait. Age is over 12 years, slip disc. 5-day-old unilateral hip radiating to the knee. Hip to the knee. Perthes disease. Young child 24 history of abdominal distension. Young child 24 hours history of abdominal distension, pyrexia, screaming, vomiting, bile stain, small amount of blood and mucus on per rectal. Now screaming, you think of intersusception, but there is fever and bile stain, vomitings also. Let us see screaming if it is taken as a Meckel's divertical was the option. That's why it is intersusception. 2-day baby, vomiting and abdominal distension, past mucus. So it is just a newborn and 2 days and past mucus. There is abdominal distension. If there is cystic fibrosis, you have to think of it, or muconemyelitis. Yeah, this is muconemyelitis, cystic fibrosis. Which nerve passing from upper lateral psoas muscle? Upper lateral, if compressed by the abscess, cause pain in the anterolateral of the thigh. Lateral side of the thigh, it is melalgia parasthetica L23. This is lateral cutaneous nerve of the thigh. Urethral injury in the trauma, blood at the meatus, high riding prostate. So urethral injury, prostate, high riding, membranous urethra. Next question is traumatic aortic injury on X-ray, widened mediastinum. Most likely descending aorta is always there, which is in the mediastinum. Descending stena distal to left subclavian, which is most of the common in dislocation injury, traumatic. Patient presented with sweating, diarrhea, increased pulse rate. So thyroid enlargement, thyroid storm management. Now there is thyroid storm, hyperthyroidism, thyroid storm is there. So sweating, diarrhea and increased pulse rate, tachycardia. So you have to control this with thionamides and beta blockers. Supply of labia majora minora. So lymph nodes, and this is regarding the nerve supply. Genital branch of genitofemoral nerve. So there is one more question. Supply of labia majora obturata is wrong. So this is the nerve supply. Genital nerve femoral branch is blue color. Genital branch, genital. So inguinal. So it is an ilioinguinal. This is very close. Obturate is the medial cutaneous scrotum and labia. Here you can see this is ilioinguinal, genital branch, scrotum, lateral, pudendal is to the base, and it is genital branch of genitofemoral nerve. Yes. So you can see this one, genital branch of genitofemoral nerve is L1-2. Genital branch cross iliac vessels, sensory branches to anterior scrotum and mons and upper thigh. It is also cremastic muscle. Cremastic reflex is also by this. Best method of sterilization of the arthroscope: glutaraldehyde, autoclave, ethylene oxide. Ethylene oxide is the latest. Some may call glutaraldehyde, hydrogen, ethylene oxide. So ethylene oxide. Ethylene oxide, ETO sterilization, or ethylene oxide. So let us see. Structures of greater risk during splenectomy. It is tail of the pancreas. Lung function test, FEV1 1.8, FEV CVS showing restrictive pulmonary fibrosis. I think these questions were okay. Repeating, okay, no problem. They might be repeating. 10th November. So next question was non-differentiated thyroid carcinoma spreading rapidly with stridor, resulting in acute recurrent recurrence of cancer, anaplastic. What is true about relation between the brachial artery and biceps tendon? MBBR. Hmm? This is brachial artery and biceps. Brachial artery is lateral to bicep tendon is lateral to brachial artery. That is the thing. Yes, the figure. Hernia defect because of pleuroperitoneal membrane. It is Bogdale. Elderly man referred back pain to the legs, improved on pushing trolley, lumbar stenosis. Carpometacarpal joint of the thumb you think of wearing the sandal you use the thumb, that's why saddle type of joint. Just try to remember thumb, it is saddle joint. 50-year-old female was brought into emergency department for motor vehicle accident, blood pressure 80/60. What hormone would be initially released? Renin. 25-year man sustained rotafaction present with the Glasgow Coma scale V3. He has dilated pupil and hypertension and bradycardia with respiratory rate is slow and irregular. Which of the following is in bradycardia? So it is vagal stimulation, increase activity of brake arch, increase activity of carotid body, increase activity of cardio, decrease activity, increase activity. Any increase in activity first of all lead to hypertension, increase activity of the vagus nerve is carried from sinuses, increase activity aortic and carotid sinuses. So this vagus stimulation is there. Increase intracranial pressure, decrease pulmonary pressure, that is the only thing. Stimulation of the aortic and baroreceptors, parasympathetic. Vagus causes bradycardia. Histology of medullary thyroid carcinoma with pink amorphous is amyloid stroma. Elderly lady presents with sensorineural hearing loss. Imaging showed a tumor located at the cerebropontanal. Which nerve? Cerebropontanal vestibulocochlear nerve. So there is two nerve, four nerve. This is the diagram of the nerves. This is a beautiful diagram of first two olfactory optic from the cerebrum, second two oculomotor trochlear from the midbrain, then next four trigeminal, abducent, facial, vestibulocochlear pons, then last from the medulla, glossopharyngeal, vagus, accessory and hypoglossal. Reciprocal of absolute risk reduction is number needed to treat. Again, why I am getting that this recorded. NHS would like to length. Just I will stop it here.